All right, I'm going to talk to you a little bit about Susac Syndrome, and that is a microangiopathy. It has predilection for the brain and the cochlea and the retina. And so it is a microangiopathy of brain, cochlea, and retina, also known as the Susac Syndrome. It presents with hearing loss, lower frequency hearing loss, so they need to have an audiogram. It's usually bilateral and moderate to severe. The retina finding is branch retinal artery occlusion, and it's typically young females, as you would expect with presumed autoimmune disorder. And in the brain, we're going to have multiple neurologic presentations depending on where the lesions are. The characteristic lesion is a corpus callosal T1 hole in the corpus callosum on the MRI scan. So Susac syndrome, young female, recurrent multifocal branch retinal artery occlusions, hearing loss, bilateral, symmetric, severe, low frequency, and brain lesions, supratentorial, white matter lesions, and the T1 corpus callosal holes. This is a diagnosis of exclusion. Fluorescein angiogram sometimes shows a gas plaque, which is a focal area of hyperfluorescence just around the vessel adjacent to the branch retinal artery occlusion. The treatment is, as you would expect, immunosuppressive agents, steroids, Cellcept, mycophenolate, the usual things. There's no cure. It is a clinical diagnosis. There's no laboratory finding. And if you don't have the corpus callosal black holes, you really have to make this on a clinical basis. There's no actual test for this. So you should think about Susac in young females with recurrent VRAO, hearing loss, and white matter lesions.